This is Dr. Corey Maas on Looking Your Best. I wanted to talk a little bit, we have a lot of questions about this because of the exciting things that are happening with the world of fillers about facial volume. And it's exciting for a few reasons. One of them is that the use of your own fat, autologous fat transfer is what is very commonly called, is exciting in many ways because originally we were talking only about how many fat cells survived when we move it from some area where we don't want it, like our hips or abdomen or inner or outer thighs, some area where you don't want fat, in volumes that are not very large. We're talking about 1, 2, 3 teaspoons, sometimes a little bit more, into an area where we do want it, where we're losing volume, like in the mid-face area, cheeks, the temple region. And when we're doing that, we're actually modifying, we're first of all very carefully harvesting the fat with liposuction techniques that are gentle. And then we're cleaning the fat very gently also, either using gravity or there's some systems that can even enhance that, although those are they've shown limited value, just handling the tissue very gently. When I say the tissue, along with human fat, human adipose tissue, there's a stromovascular layer, we call it, which is fibrous tissue and tiny little blood vessels. And along with the fibrous layer with the tiny little blood vessels are specialized cells called periocytes, which are amongst the stem cells, or mesenchymal stem cells as they're often referred to, and probably, as Dr. Arnold Kaplan, one of the leaders of the biology of this, is better described as mesenchymal signaling cells, going along with the fat. So there's not just fat cells being transferred. Mesenchymal stem cells or mesenchymal signaling cells, such as periocytes, move along with the fat. And when we harvest this gently and we prepare it carefully by moving it between 2 syringes so that it's able to be injected with a slightly larger needle, but done with local anesthesia. Still, it's not moved as a big clump of fat. It's injected just like some of the other cosmetic injections we do. We're seeing not only volume enhancement, and some of those fat cells do survive. We typically think of 25 to 50%, depending on the technique. But we also know that it doesn't matter so much how many fat cells survive with these important mesenchymal signaling cells going along with it, where skin changes on the surface are even seen by turning on your body's own repair mechanisms with the transfer. So we do see augmentation with the permanence of some of the transferred fat cells, but we also see new collagen production and changes in the soft tissues as well as the skin surface with fat transfer. Now again, that procedure for volumizing the face is a little more invasive, meaning that you can have swelling and bruising, so you have to be prepared for it. It's often done in my practice along with a surgical procedure such as a brow or facelift or eyelid surgery. But it's a procedure that is the fat transfer, that has long-lasting benefits far beyond and more important than exactly how many fat cells survive. So a great adjunct. And if people are willing to have a little downtime and recovery, it can certainly be done by itself. It can be done in the office or as an outpatient procedure, but has to be done under proper sterile technique. Now, facial volume is not limited to using fat cells. The areas that we most commonly see the loss of volume, and people do notice this. If you lose weight, the first place is, especially as we age, if you lose weight, the first place you're going to notice it is in your face. The temple area, the area above your cheek and in front of your hairline, is one area where we don't want to see it hollow. We want the face to retain a nice heart or oval shape to it. And as that starts to come in the temple area, or we start to see volume loss in the mid-face, it makes you look tired. And that's one of the big complaints we see with volume loss, is that I look tired, or I look weathered or worn out, and restoring that volume is a big step in improving those concerns. So I kind of jumped a little ahead and got into fat transfer because it's so exciting with the mesenchymal signaling cells like periocytes and others that we're moving along with the fat. But there are a number of new products that are being developed and that are already released that are specifically designed for facial volume replacement, such as the Juvederm Voluma product, which is studied and published specifically in the midface. There are competitors like the Restylane Lift product, which have been shown to be effective in terms of the general improvement, not quite as long lasting, but still very effective, as well as some of the microparticulate fillers, such as Radiesse, which is a small particle calcium hydroxylapatite, which is a mouthful, but it's basically your bone mineral that's in a gelatin, and we always dilute that with local anesthesia so we can distribute it evenly through the midface and get a nice correction with it. Typically with that product, the Radiesse, there's a little bit of overcorrection with the local anesthesia added, of course, which goes down in really overnight. And then the body is stimulated to make new collagen, and these new stem cells are actually stimulated along with the collagen stimulation from the small particles. Sculptra is another microparticulate product. I think it pretty much reached its zenith a few years ago. When it was used extensively with lipoatrophy, especially HIV-related lipoatrophy, but was used for just age-related lipoatrophy, where the fat in the face is lost with age. It is an observation, and it's unfortunate, but it's one we live with, that we have a tendency as we get older to lose volume in the face and gain it in other areas of our body. But there's very good treatment for those facial losses. So I don't encourage anybody to get fat to try to make their face more plump. It's really stay in shape, and we have treatments for the facial volume loss. So there are a number of cosmetic, out of the syringe, cosmetic injectable fillers. I listed just a few in the Juvederm Voluma, the Radiesse product, which is microparticulate, the Restylane Lift product, and there's some newer ones that are out that we're still looking at in the Restylane Define products. And those are exciting. It's exciting to have new products to look at. Duration is one of the big focuses now when we look at any type of cosmetic filler, because people really don't want to come in every 6 months or so for fillers. And I can tell you that with some of these newer ones, the data is showing, for example, with the Juvederm Voluma, that almost half of the subjects treated are still fully corrected in the midface volume area after 2 years. So meaning probably every 3 or 4 years doing treatments or doing some touch-up treatments in a couple years rather than full volume treatments. And the other ones are close behind, if not right there with Voluma. If you have any questions about volume restoration, which, as I mentioned before, includes autologous fat transfer and some of these very good new fillers that have come out, please don't hesitate to write at drmaas.com. You can send pictures of yourself or even videos. I'm happy to discuss them both privately and publicly. If you want others to learn, you can have your eyes blocked out if you want. And as always, it's my pleasure to discuss these with you. This is Dr. Corey Maas on Looking Your Best.